Urogynecology and reconstructive pelvic surgery encompasses treatment for a number of conditions that affect women, including urinary incontinence, pelvic organ prolapse, complications of other pelvic surgeries, including hysterectomy, mesh-augmented surgeries, urinary fistula, as well as non-surgical conditions, including urinary tract infection and pelvic pain. These conditions are very common among women, but not commonly discussed. And so women often suffer in silence because they are not aware that there are effective and safe treatments that are available. There are a variety of options for treatment in a number of pelvic health conditions. So I'll talk a little bit about stress urinary incontinence, which is the involuntary loss of urine with activity like coughing, laughing, sneezing, exercising, or lifting. Up to a third of women can experience this type of incontinence in their lifetime, and risk factors for this condition include prior pregnancy, vaginal delivery, birth complications like tears, use of forceps. There are a lot of effective non-surgical options, including pelvic floor physical therapy, where a woman works with a highly specialized therapist to help train her pelvic floor muscles to address incontinence. There are also vaginal inserts, like pessaries, that can help support the urethra from the outside to provide relief from this incontinence. There are also special types of supports that can be worn internally to help women control symptoms of stress incontinence. There are also effective surgical options for stress urinary incontinence, including the use of bulking agents and the sling procedure. Bulking agents are sort of like fillers for the urethra that can provide support and help to control symptoms of stress incontinence. The sling surgery can be performed with a synthetic material or with a woman's own tissue, and it provides a hammock of support around the urethra to allow women more freedom and activity. All of our surgical procedures are highly effective and safe and are often performed on an outpatient basis. There can be a wide range of candidates for surgical procedures. There are a number of factors that go into the decision-making around surgery for stress incontinence, including a woman's goals, her preferences, her health, and her level of physical activity. It's important to have a very detailed discussion with your surgeon to decide what's right for you. We're always looking for new ways to treat our patients. There are new frontiers of treatment for incontinence, which include the use of women's own stem cells and tissues to treat conditions like stress urinary incontinence. There are new innovations in the pipeline, exploring the use of nerve stimulation and brain stimulation to treat incontinence. At Keck Medicine of USC, we're committed to offering our patients the state-of-the-art with regard to treatment for pelvic floor disorders. I think it's very important for women to know that there are a lot of treatments for pelvic floor disorders, and they do not have to suffer in silence. I think that you'll find that we can find a treatment strategy that really honors your preferences, your goals, and your health.